Started, sir.
Yeah. Yeah. And the second round is going to be Dr. Vimalamika. This round is going to be a little bit different. They have 5 sets of clinical scenario, and each team will get 4 questions each. So all the 20 questions need not be answered by all the teams. Only the 4 questions which is directed to each of the teams. That in first set of 4 will go to the first team. So 5 clinical scenarios for each team. You have to answer those ones. That is going to be the second round. The third round is going to be by Professor Dr. Ilavenil. It's going to be complications and controversies. That is like a regular Kahoot. So on the fourth round is going to be the visual round. I'll rather explain you at the start of the, I think I have explained you already in the pre-meet. So I'll explain again when we start that program, right? It has some specific timing also. I'll let you know about the timing at the start of each round. It has 4 sets of round. Video round, 4 pictures, connecting clues, and the spot diagnosis round. I'll come to that later. And audience also, you be alert. There will be a question at the end of each round. You are entitled to get a certificate if you have got the answer right. So I like to the audience also to be participating more. So we have tried at most at our best to make it as fair as possible, because we, the quiz masters, even doesn't know the questions of other masters. So I like to all of you to play the game a bit fair, so that there won't be any issues. It's going to be a learning platform, so winning is not important. So be fair on all spots, right? It's going to be the test of your ability and not Google's ability. So don't use any internet and Google to answer questions. The speed matters. So as soon questions are going to be rather relatively easier only. So you just answer and let it be a fair play, right? Shall we start? Over to Dr. Madhupriya, Madhu Lakshmi.
Shall I share the screen, ma'am?
You're muted.
Thank you, sir. Good luck to all the participants. Once your game pin comes, you can start off with the quiz. The first round is on investigations. That's your game pin, 4401379. Okay, so I can see the teams joining. As Sir already mentioned, the questions are not very hard, but the speed matters. So all the best again. We need 2 more teams to join in. Okay, 1 more.
Team 20.
There's 1 more team which was yet to join. Okay, we have all the 5 teams. So shall we start? Mr. Chandra, I think we can start now. Okay, that's your round 1 and question 1. What blood investigations are needed in a patient on warfarin prior to any surgical procedure? Do you need the prothrombin time, activated partial thromboplastin time, INR, or just the prothrombin time and INR, or APTT and INR, or clotting time, bleeding time, PT, APTT, and INR? 4 of you have got it right. So it's prothrombin time and INR. Warfarin is decreases the blood clotting by blocking the vitamin K dependent clotting factors. So vitamin K dependent clotting factors are going to be dependent on your prothrombin time. So only the prothrombin time and INR should suffice for your blood investigation. However, if you suspect that the patient can have a disseminated intravascular coagulation, then you might want to also check your APTT. Next question. Oh, before that, the scoreboard. Team 35 is on the lead, followed by 18 and 20. Question 2. What investigations are routinely done for a patient indicated to undergo a contrast CT? Is it CBC, BUN, HIV, and hepatitis? Is it BUN and creatinine, CBC, creatinine, HIV, hepatitis, GFR, and CBC? BUN is your blood urea nitrogen, CBC is your complete blood count, GFR is glomerular filtration rate. So which is the blood investigation which is routinely done for a patient who is undergoing contrast CT? All of you have got it right. I think you've been giving it for your patients. Yes, blood urea nitrogen and creatinine are measured to check if the patient's renal function is normal. If there is an elevated level, it means that the renal clearance is not happening well, so the patient can have tubular necrosis. Scoreboard. Team 35 is fast with fingers too. Congratulations. Team, third question. Most common immediate postoperative electrolyte imbalance. Is it hypokalemia and hypernatremia? Is it hyperkalemia and hyponatremia? Is it hyponatremia and hypokalemia and hypernatremia and hyperkalemia? Which electrolyte imbalance is most common? Okay, 2 of you have got it right. It's hyponatremia and hypokalemia. As a fact, because of the stress and surgery, initially there is an increase in levels of both potassium and sodium. However, there is a lot of dilution that happens, resulting in hyponatremia and hypokalemia. Apart from this, the other electrolyte that can have an imbalance will be magnesium. There can also be hypomagnesia. Scoreboard. Let's see which of the 2 teams which got it right. Team 35 and Team 34 is close second. Let's move Team 18 to third spot. Next question. In hyperparathyroidism, the following is seen. I think this is a pretty straightforward question. This is primary hyperthyroidism. Okay, the question is for primary hyperparathyroidism. Is it raised serum calcium, serum phosphate, and prothrombin parathyroid hormones? Is it raised serum calcium, low serum phosphate, and increased parathyroid hormone? Or, okay, all of you've got it right. It's raised serum calcium, low serum phosphate, and elevated PTH. If this question was secondary hyperparathyroidism, then you would have a low serum calcium, an increased serum phosphate, and an elevated parathyroid hormone. All right? Good. Scoreboard. Team 35 still on lead. Very good. The next question. ABG is done to test. Why do we need ABG? Is it to test the bicarbonate levels? Is it to check acid-base imbalance? Is it for checking the saturation of oxygen and carbon dioxide, or all of the above? Again, all 5 of you, right? All of the above, yes. So arterial blood gas is important in critically ill patients, and you need to this mainly to identify if the patients are going for any acidosis or alkalosis, whether it's metabolic or respiratory. That's the reason we get the ABG done. Right? Good. Next question, 6. I think I'm more excited now. Interpret the radiographic feature and diagnosis. What do you see in this radiograph? Is it flower pot appearance, hemangioma, sunburst appearance, osteosarcoma, tennis racket appearance, myxoma, sundray appearance, osteopetrosis? I think Team 35 is shaking their head. They've already done it. Again. 5 of you right. Sunburst appearance, osteosarcoma. Sundray appearance is basically a periosteal reaction. So what you see is basically a periosteitis, a kind of an aggressive periosteitis. It's usually seen in osteosarcoma. It can also be seen in intraosseous hemangioma. Okay. Next, the scoreboard. Team 35 still on a good lead, followed by Team 34, 18, and 20.
Just a question, Jim. Why audience is 5? I see one more team which is participating. 6.
Yeah, there's
I see a lot of 6. Yeah, audience should not be coming up, right?
Yes, sir. I think some audience has taken this quiz.
Yeah, I know,
So
because I got scores like 6 or something like that. I mean, 6 members getting it. I think audience need not participate right now. Can we ask them to not to participate?
Can you delete that, please?
We move on to question number 7.
An announcement for the participants, for the audience. Sorry, yeah.
Where do you see this radiographic appearance? Do you see this in sickle cell anemia and thalassemia, iron deficiency anemia, and congenital heart disease, both A and B, or none of the above? Where do you see this kind of a radiographic appearance? One is right, sickle cell anemia and thalassemia. What you saw is the hair on end appearance. It's because the diploid spaces of the skull vault is actually expanded. That's because of the thickening of the trabeculae. And this gives a hair on end appearance. You see it mostly in sickle cell anemia and thalassemia. You might also see it in hereditary spherocytosis and even in enzyme deficiency, as in G6PD deficiency, and in few cases of neuroblastoma. Okay. Scores. Team 35, 34, 20, 18. Okay, that seems to be a close fight for the second, third place all the time, but the first place seems to be consistent. Come on, all of you. Next question, team, question 8. Where do you see this radiographic appearance? Do you see this in elevated intracranial pressure and craniosynostosis, decreased intracranial pressure and craniosynostosis, elevated intracranial pressure and epilepsy? Wow, all 5 right? It's called beaten copper appearance, and you see it in obviously in elevated intracranial pressure. And this is because of the increased pressure, the internal surface of the wall gets disfigured, and it gives this kind of an appearance. It's most commonly seen in hydrocephalus as well as any kind of a craniosynostosis. Scoreboard. Team 35 still on lead. Good. Next question. Question number 9. What's the imaging and sign? I'm sure it's going to be a straight cakewalk. What's the imaging and sign? Axial section of CT, hanging drop sign, coronal section of CT, teardrop sign, coronal section of CT and teardrop sign. Yes, that's a classical picture. I don't think you really need to explain. It's seen in orbital blowout fracture. What you saw was an inferior wall. The floor of the orbit was fractured, and it gave you a classical hanging drop appearance or the teardrop sign. And the section that you saw is a coronal section of the CT. Scoreboard. Now we have team 34 in first position and team 35 just in the second. Question number 10. What radiographic view and normal anatomy is represented here? Is it the 15-degree occipitomental view and Campbell lines that you see? Is it the 15-degree occipitomental view and Dolan lines that you see? Or 30-degree occipitomental view and the Campbell lines? 30-degree occipital view and Dolan lines. 4 of you have got it right. It's 30-degree occipitomental view and Dolan lines. It's basically seen to elicit the zygomatic portion of the bone well. It's Waters view, angled PA view with a patient gazing upwards. The scoreboard. Team 34 is now on the lead with team 35 in second spot. Question 11. What imaging is used here and diagnosis? A pretty straightforward question again. Is it the CT mandible showing an impacted supernumerary tooth? Is it the occlusal view of mandible showing an impacted tooth? Is it occlusal view of the mandible showing a silolith, or is it the CT mandible showing a silolith? 4 of you have got it right. It's occlusal view of the mandible showing a silolith. And what you saw is along the Watten's duct. The submandibular gland is highly prone to formation of siloliths, and you can see it very well elicited in the occlusal view of the mandible. Scoreboard. Team 34 is now on the lead and team 35 in second spot. Question number 12. Identify the position of impacted tooth if the second radiograph is taken with a mesial tube shift. Is the tooth buccally placed, palatally placed, mesially placed, or distally placed? The tube has been shifted mesially. Okay, all 5 have got it right. Yes, it's a slob technique. As you've got the answer right, I think I don't have to explain further. The tube is shifted mesially, but the tooth has been moved distally. So same side lingual, opposite side buccal. Very good. Scoreboard. Seems like the quiz is very simple. All of you getting everything right. Scoreboard. Team 34, first position, and team 35 on second. Team 20 is third. The next question, question number 13. Interpret the image. Is this a contrast CT showing anterior disc displacement, or is it a contrast CT showing posterior disc displacement, or an MRI showing anterior disc displacement, or an MRI showing posterior disc displacement? This is actually taken in a closed mouth position. 3 of you got it right. It's an MRI showing anterior disc displacement, and I mentioned to you it's in the closed mouth position. Very good. I don't think you need to explain more. MRI is the best radiograph for seeing the TMJ, especially in cases of internal derangements. And what you saw there was an anterior disc displacement in a closed mouth position. If the same MRI had been taken in an open mouth position, then the disc would have moved even more in an upward and an anterior position. Scoreboard. Team 34 followed by team 35, 20. I think we have the same statistics. There's not much of a change. Question 14. The sialography is depictive of Sjogren's syndrome, sialadenitis, sialidochitis, or a normal anatomy of salivary gland. The sialography is depictive of Sjogren's, sialadenitis, sialidochitis, or a normal anatomy of the salivary gland. 4 of you got it right. Normal anatomy of salivary gland, yes, because you can see the main duct with an even diameter of 1 to 2 mm width, and then you can see the gland being branched regularly and it tapers towards the periphery of the gland. So basically, it's a tree in a winter appearance. What you see in Sjogren's syndrome is a cherry blossom appearance, and in sialadenitis, you will see an apple tree in blossom, and in sialidochitis, you will see a sausage pattern-like appearance. Scoreboard. So we have a small change in 4th position. Team 8 has come, and team 18 is in the 5th position now. Next question. Fixative used for placing biopsy specimen should be minimum dash times the bulk of the tissue. So when you're putting a biopsy specimen inside the formalin, how much content of formalin should you take? Should it be 5 times more than the specimen, 10 times more than the specimen? 4 of you right, 10 times, minimum 10 times more than the specimen, so that the specimen is surrounded all by the formalin. So it will be well immersed in formalin. Good, the scoreboard. Okay, again, team 18 on 4th position and team 8 on the 5th position. 1, 2, 3 is on the same levels. Good. Move on to the 16th question. What is the instrument? Is it a fine needle aspiration cytology? Is it true cut needle? Is it a hand drill, or is it a cryoprobe? True cut needle, yes. True cut needle, it's a specimen usually taken for punch biopsies. It's very commonly used in case of salivary gland biopsies in our specialty. Scoreboard. Okay, 1, 2, 3 seems to be consistent, and 8 and 18 are moving 4 and 5. The next question, 17. Name the investigation. Is it a CT angiogram, MR angiogram? Is it a contrast CT or a contrast MRI? Just name the investigation. I think it's pretty easy considering all the questions have been answered well. So 4 of you got it right. It's MR angiogram showing the carotid arteries. So you basically use this investigation whenever there is a vascular anomaly to know where is the feeder vessel. Scoreboard. Team 34, 35, 20. I think we have the same statistics. We can move on to the next question. Bencejones protein urine test is done for. Again, a straightforward question. Is it multiple sclerosis, infectious mononucleosis, rheumatic fever, or multiple myeloma? All have got it right. It is done in multiple myeloma, and Bencejones proteins is nothing but monoclonal monoclonal globulin protein light chain. It's also found in Waldenström macroglobulinemia. Scoreboard. Team 34, 35, 20. Same statistics. And we move on to the 19th question, last but one. The classical histopathological finding is. So what cell is it? Is it a pleomorphic cell? Is it a giant cell? Is it a basal cell or a ghost cell? I think it's a pretty classical histopathological. Giant cell, well done. You could see the cell was multinucleated and the nucleus was arranged around the peripheries. So giant cells are nothing but a conglomeration of histiocytes, and there are various types of giant cells that you see. What you see here was a Langhans type of giant cell, most commonly seen in tuberculosis or even in other granulomatous lesions, right? The last question. Okay, before that, the scoreboard, and then we move to the last question. 34, 35, 20, and same statistics. Last question for this round. And very simple question again. Name the instruments. Is it a fiber optic tube? Is it an electric nerve stimulator, arthroscope, or a dynamic navigation guide and probes? All five right. It's an arthroscope, and it's an all-in-one arthroscope, which has the arthroscope, irrigation, and the working channel all in one. Well done. I think it was a very, very easy quiz, or did you guys make it very easy? I really don't know, but extremely well done, all five teams. The final score. Team 20 is on third position. Team 35 is on second position, and team 34 is on the first position, having got 19 out of 28. And on an average, all of you have got like, what do you say, more than 75%, right? That's like too good. Congratulations, all of you. And now over to Arun sir again. Thank you.
Thank you, Madhu. That looks like a power play, right? So
Yeah.
they have scored very fast. And your questioning also is like a rapid fire question round. Okay. Well played, all teams. So it was like before she could finish the question, I can see the answers popping up. That's great. And do you have a question for the audience right now, Madhu?
I think the audience questions, Dr. Venil, are you doing the audience question?
Is it going to come now or later on?
The audience question, I thought Dr. Venil was doing it, sir.
Okay. We'll have it later on.
Question going to come up now, or we just ask the question?
I thought it's in between the rounds.
No, sir.
Venil,
Do we just ask the question just like that?
Yeah, just like that. They will answer in the chat box. Yeah.
I'm sorry. Yes. Now I'm unmuted. How many students do we have waiting for the audience quiz? Mr. Chandru? I see 29. All of them are students?
Yeah, whoever it is, doesn't matter.
Okay, fine. Yeah, then it's fine. Madhu, we can start.
They have to answer in the chat box, right?
Yes.
Yes, with the name or something other. How will you identify that?
Question, right?
Yes.
Okay. One of the following is not a feature of Still's disease. Okay, the question is, one of the following is not a feature of Still disease. Choices are: occurs mostly in adults above 40 years, can affect any joint, or is it usually accompanied by several systemic signs, or is it a major complication of this disease is cardiac failure? Can I repeat the answers, choices? The choices: A, occurs mostly in adults above 40 years. B, can affect any joint. C, usually accompanied by several systemic signs. And D, major complications of this disease is cardiac failure. One of this is not a feature of Still disease.
We'll wait for a few seconds and then we'll get the answers.
Sir, I'm saying on behalf of team 20, we are having some issues with the net. So can two of us share a single screen?
Yeah.
Thank you, sir.
Yeah, that's the buzzer. That's the buzzer, right?
I think among
Yeah.
the participants, and
Time enough. Can we go for the answers?
the answer is that it occurs mostly in adults above 40 years is not true because it usually occurs in children.
What is the option? A, B, and C?
A.
Okay, so which team? I think Satya Bama. We got it right. You were supposed to respond in the chat. Is that right? I see the chat room. Satya Bama answers A. She was the first one to respond.
Yes, sir.
Okay. Right. So Satya Bama is the winner from the audience. You will get a certificate. Kindly send your details. We'll get your details later. Right. Thank you. So we'll move on to the next round. Dr. Vimalamika, are you ready?
Yes. Yes, sir.
Yes. We'll go to the second round. This round is going to be a clinical scenario round. Only the team A is going. Vimalamika, you just announce the team which is going to answer, and then start off with the questions. Right.
Yes.
So other teams, you don't answer. Only the first team is going to answer, and the order is going to be like this. Team 1 is going to be team 08, team 2 is 18, team 3 is 34, team 4 is 20, and team 5 is 35. So first team you're going to get the questions is 08.
No, Dr. Arun, we just have one common question which all the teams will answer. Then based on who comes first, second, third, fourth,
Oh, you're
fifth.
going to give a choice like that? Then you handle, right? So I'm not going to give the rules then. So you don't want to be partial, like you want to give them a chance. Order for selecting the order.
Okay. So now
Okay, fine. Over to you then. You just play the rules. Yeah, thank you.
before I start this round, I just want to tell you the order. So the person who gets the first score will get the questions in orthognathic surgery. The person who scores second will get the questions related to trauma. The person or the team which scores third will get questions related to cleft lip and palate. The person who comes fourth will get questions related to cancer. And the person who comes fifth will get questions related to TMJ. Okay, are you all clear? Okay, so this is your question. Okay, so this is their order. What topic you'll get on. Okay, based on first, second, third, fourth, fifth, how you come. After you answer the question that is going to be posed towards you now. Okay. Chandru, can we have that question, please? This is just a basic, like something like a general knowledge question. This is your game pin for that. Can you just use this game pin and log in?
May I request the audience not to join, please? This is only for the team. This is not for the audience. Audience will get the question at the end of this round.
Where is team 20? Yes, I think we have all 5 teams now. Can we go on to have the question? Who started the first air ambulance? Was it a pilot? Was it a doctor or a pastor or a politician? So So 2 of them answered correctly. Just see the scores so that I can give the questions. Okay, it's team 20 who's come first. So team 20 gets questions in orthognathic. Okay, then 18 in trauma, 34, 8, and 35. Okay, fine. Team 20, can we have the orthognathic questions, Chandru?
Team 35 deliberately answered last time. You want questions on T and J. I would have done the same.
Just few seconds, ma'am.
Don't worry, all the questions are clinically related, and I don't think it's going to be very tough. Okay. So we have 4 questions. So it's team 20. If you're taking, now that orthognathic has come to you, you'll have 4 questions, okay? And all the questions will be related to orthognathic surgery. Fine. Similarly, like that, it is for all the other teams.
Clear instructions for again. Rest of the teams, you should not be answering these things. Only it's for team first team.
Yes, it's only for team 20. Okay. So now there's a chance for the other teams to do well. Answer quickly, answer right, and you might come up in the scoring. Okay. So team 20, only you type in the game pin, please. Connectivity issues, team 20. Yeah, okay. Now we have team 20, Smarajit, Batra, and Kuldeep. Okay, who's going to take the answers? It has to be a single person, okay?
Oh, ma'am. I'll.
You are?
Ma'am, Smarajit.
Okay, Smarajit will take these questions. Okay, Chandru, can I have the questions, please? So the orthognathic surgery, the first question. Okay, the end metabolic degradation byproduct of bioresorbable osseous fixation devices are glycolic acid, lactic acid, carbon dioxide and water, or acetic acid. Okay, so it's carbon dioxide and water. Okay, next question. So this is a cephalometric question. Effective length of maxilla is measured between the points. Point A to PTM, ANS to PNS, N perpendicular to PNS, or N perpendicular PTM. Correct, ANS to PNS. Third question. Okay. In bilateral sagittal split, the medial ramus osteotomy ends at the lingula, posterior to the lingula, anterior, or at the posterior border of the ramus? Correct. No, sorry, I've answered it wrong. It's no, it's correct. Just posterior to the lingula. I think I've answered wrong, but the correct answer is just posterior to the lingula. Okay, if you go to the end of the ramus, then you'll have the condyle and the cornoid as a separate fragment. Okay. Okay. Next question, please. Give it. Okay, fourth question, please. Okay, Okay, what is considered a bad split in BSSO procedures? Is it the fracture of the buccal cortex, or is fracture of the vertical osteotomy going on to the inferior, anterior to the inferior alveolar foramen, lower border fracture, or none of the above? Yes, the correct answer is fracture of the buccal cortex of the body of man. Okay, so these are the 4 questions for the first team. Now, team 18 has to take up. Okay, we'll see the scoreboard. So these points will be added onto your round 1. Okay, fine. Now it's team 18 who has to log in using the game pin. Okay, so for you, you will have questions related to trauma. Chandru, the game pin, and shall we start? I think team 18 is our Ahmedabad College. Okay, who's going to this thing? Ahmed College, sorry. And who's going to answer these questions?
Ma'am, I'm going to answer team 18A.
Your name, please?
Shubho, Dr. Shubho.
Shubho, okay. So Dr. Shubho is going to be answering these questions. So he's going to use this game pin and log in. So he's in. Can we have the questions, please? Okay, this is the trauma round. The first question. Which is the only attachment that the medial canthus does not have? Is it the anterior, inferior, posterior, or superior? The correct answer is the inferior attachment, okay? Because the anterior attachment is attached to the anterior lacrimal crest. The posterior attachment is attached to the posterior lacrimal crest, and you have a superior attachment which is attached to the frontal bone, okay? Fine. Next question. Okay. So what is your spot diagnosis? Is it a compound comminuted nasal bone fracture, or is it a laceration with the right-sided telecanthus, or laceration with left-sided, or it's just a facial laceration with hyperparathyroidism? Correct answer, it's a laceration with left-sided telecanthus and rounding of the medial canthus. Okay, because what are the indicative features? You saw that the medial canthus was rounded on the left side. There was an increase in the canthal distance on the left side. That is why the telecanthus, and the horizontal palpebral fissure was narrowed down. Okay. Next question. So what is a simple clinical test to confirm the diagnosis of a telecanthus? You bimanually palpate, or do a force duction test, or there's something known as a bowstring test, or the Schirmer test.
Ma'am, there is some issue with my Kahoot.
Yes, it's a bowstring test. So how do you do the bowstring test? You have to place one finger on the medial canthal area, and the other finger is used to pull the lateral canthal region, and you can feel the tautness of the medial canthal tendon. If it is not there, then you can confirm that there is a medial canthal avulsion. Okay. 4th question, please. So now for the above patient, what do you think was the procedure that was done? ORIF and repair of the laceration, or transnasal wiring and repair of laceration, or have I done a canthopexy and repair of laceration, or just repair of the laceration? Yes, there was a canthopexy and repair of laceration. If you had seen that picture, what we had done is we had used a wire, 26 gauge wire, to catch hold of the medial canthal tendon. We had done a transnasal hole, drilled it, and we had attached it to the opposite side of the medial canthal area. Okay. Now the point of attachment is superior and posterior to the horizontal attachment of the normal medial canthus. Okay. Yeah. So you've answered 4 questions, and so the round is over for you. Now we'll have the third team. Again, this score will be added to your first round score. Okay. Okay. So now I want team number 34 to log in with a game pin that we're going to give. Okay. Team 34 is PMS College. Can I know who's going to answer?
Ma'am, I'll be answering.
Name, sir?
Dr. Matthew.
Dr. Matthew. Okay. Dr. Matthew is going to take this round. Okay. Dr. Matthew, please log in with the game pin that is going to be put up. So now this team will get questions related to cleft lip and palate. Okay. So your game pin, Dr. Matthew. Yes, he's logged in. Can we have the questions, please? Okay. For a Millard's rotation and advancement flap, which is the rotation flap and which is the advancement flap? I've given the diagram. We put 2 points, A and B. Okay, so now you have to tell me correctly whether point A is the rotation flap and point B is the advancement flap, or whatever choices there are. Yes, point A is the rotation flap and point B is the advancement flap. Correct. Next question. What is the blood supply of the rotated pre-maxilla in case of a bilateral cleft lip and palate? So is it the posterior septal artery, anterior ethmoidal artery, lateral nasal artery, or all of the above? Doctor, yes, it's all of the above. Okay, so it's applied by all 3 of the arteries. Next question. There is a picture, so you just need to identify what that is. Is it Van der Wood's Spitz, Simonat's bands, Tessier cleft, or Moeller's line? Yes, it's a Simonat's bands, correct. Next. Identify the surgical procedure that has been done for this patient. Intravelar veloplasty, double opposing Z-plasty, radial muscle dissection, radical muscle dissection, or it's a primary pharyngeal flap. Double opposing Z-plasty, correct. This is mainly done to lengthen the palate, soft palate. Okay, so at the end of this round, team 34, I think, is leading, so they've answered all the questions. Yes, they've answered all four questions. Very good. Now we'll add these points to your first score. Okay. Now team 8. Who's going to answer in team 8? Team 8.
Dr. Subodh.
Okay, fine. Okay, so you please log in with the game pin that's going to be given to you. Subodh, you've entered?
Yes, ma'am. I'm entering the team name.
Okay, Dr. Subodh is in. Can we have the question, please? Some of the questions are related to cancer. So oncology round, the first question is, according to the TNM staging, which T stage of the cancer is seen in the above picture? T3, T4A, T4B, or T2? T4A, correct. So basically a verrucous carcinoma of the buccal mucosa, which is extended to involve the skin. Okay. T4B is when it involves the masticatory muscles, or it goes on to involve the carotid space or base of skull. Okay. So T4A is the correct answer. Next. Again, it's a picture, the same patient where some surgical procedure has been done. So I want to specifically know what has been done for the mandible. So this is after the procedure has been done. Is it a segmental mandibulectomy, total, composite resection, or is it a marginal mandibulectomy? Yes, it's a marginal mandibulectomy, correct. Okay, so basically we have done a wide local excision of the lesion along with a marginal mandibulectomy and a rim resection or a alveolectomy in the maxilla. Okay, next question. Okay, the clinical test done to determine the arterial blood supply to the hand prior to considering the radial forearm flap. Is the Allen's test, CT angiogram, arterial Doppler, or is the Finkelstein's test? Allen's test, correct. Okay, so for next question, please. So we had done a radial forearm for the patient. Now, in case I need to raise a tendon for the radial forearm, say that I've involved the lip and I want to get the lip sealed. So what is the tendon that I might take in a composite radial free forearm? Palmaris longus is the correct answer. Okay, so there only one question you got wrong. Okay, so you've answered all 4 questions. We'll see your score. Okay, there's a good chance there might be some changes in the scoreboard. Because teammate has been answering a little bit more quickly. Okay, now the last team is team 35. And who will be taking up these questions?
Ma'am,
is this? I can hear you.
Yes, ma'am. Ma'am, I'm answering the questions, ma'am.
Your name, please.
Dr. Georgie P. Sakaria.
Okay, Dr. George. So the game pin that's going to be given, only Dr. Georgie will log in. Dr. Georgie, your game pin.
Yes, ma'am.
Okay, Dr. Georgie has logged in. Can we have the question, please? What is the commonest tumor involving the condyle? So you can see one radiopaque lesion in the condyle here, which is pointed by an arrow mark. Yes, the commonest is the osteochondroma. So that's the osteochondroma that you're seeing there in the patient. Next. So what is the fossa component and mandibular component of the total mandibular joint system made of? Okay, so is the fossa component made of polyethylene and the mandible made of cobalt chromium molybdenum, or is it the other way around, or are both made of the same materials? Yes, the fossa component is made of ultra high molecular weight polyethylene, and the mandible component is made of mixture of cobalt chromium molybdenum, and it is coated with titanium. Okay, so for the patient that I showed you who had an osteochondroma, so we resected the tumor, and in order to reconstruct the joint, we did a total joint replacement. Okay, so that's what you're seeing in the picture. Next question. So pediatric mandible, TMJ ankylosis, what is the best reconstructive option for an interpositional gap arthroplasty? Yes, costochondral grafts. So because it's got a cartilage component as well as a bony component, the cartilage component contributes to the growth of the mandible. And in the series of X-rays that I've shown you, it is a 8-year follow-up of the patient where we've done a costochondral graft, and there is growth of the mandible that was present. So we operated on the child when he was 6 years old, sorry. And presently, after 8 years, there was growth of the mandible and symmetry of the face. Okay, next question. So this is the last question. Who performed the first craniofacial distraction? I think this is a very easy question. Was it Eliza Rao, McCarthy, Snyder, or Podivilla? McCarthy, yes. Good. Okay, sorry, you answered wrong. Eliza Rao did the first distraction in the lower limb. Okay, sorry. But the craniofacial distraction first was done by McCarthy. Okay, yeah. So we have come to the end of round 2. 1935, Georgie answered 3 out of 4 questions, but he's got a good scoring, I think, because he answered fast. So these scores will be combined with the first score, and then we'll see the overall outcome. Okay, thank you. Thank you all. Okay, I think now we'll have an audience round. So maybe, yes, so this is the audience round question. Audience, are you all ready? Please type your answer in the chat box, okay? So while performing an intraoral vertical ramus osteotomy, the vertical reference guideline should be marked how many millimeters away from the posterior border. So I think we have a lot of answers on the board. The correct answer is C, that is 7 millimeters. And I think it was Dr. Shivakumar Loganathan who's answered it correctly and fast.
Chandru, make a note of it. Shivakumar Loganathan is the first one to answer for the second question. Congrats, Shivakumar. You will get a certificate. Thanks. Right, that was a different round, and it gives a evenly balanced contest now. Can we have the cumulative scores, Chandru? Is it possible now? Combining the first and second rounds?
It takes some time, sir. Can I have some time, sir?
It takes some time. Okay, we'll move on to the next one. No, we'll move on to the next round. No issues. We need not waste time. Okay. Thanks, Vimala, for that interesting session. Now the third round starts. Dr. Ilavenin. This is going to be a round on complications and controversies. So now all the teams can participate. All of you log in, and then it's like the first round. Over to you,
Thank you,
Dr.
Dr.
Venin.
Arun. Yeah, thank you. So this is going to be like your usual round. Let's wait for your game pin. Well, there is. Yeah, that's team 1834. The others? Let's finish this round quickly. There's a very exciting round awaiting you all next. Yeah, the last team to join in.
Yes, ma'am. Just putting in the game pin.
Right, right. By the way, well played everyone so far. The enthusiasm is really, really commendable. Well, we have everybody in. Mr. Chandru, can we start? So here we go. The first question is, elephant foot deformity is a complication seen in fractures indicating A, non-union of dentate maxilla, malunion of edentulous maxilla, non-union of edentulous mandible, or malunion of dentate mandible. Wow, that was really fast. Okay, the answer is non-union of edentulous mandible. Very good. So you all must remember this classical clinical presentation on radiographs is mainly because of hibernation of fractured ends. So you must freshen up the ends, remove the interposed fibrous tissue, and then only fix the fracture. Let's look at the scoreboard. So it's team 34 on top with 975. Okay, let's move on to the next question. Grievous injuries are taken for medico-legal considerations under the following section of Indian Penal Code. This is a very interesting question. So under what section? Is it section 330, section 320, section 340, or section 321? Well done. I really didn't expect you all to answer this right. The answer is section 320. Very good. This is very important for your private practice. Grievous injury includes emasculation, disfigurement of face, loss of function of any organ, anything that endangers your life, makes a patient suffer in pain for 20 days. Now, this is very interesting. And fracture or dislocation of bone or even tooth. All of these would come under section 320. Okay, scoreboard, please. It's team 35 now. Okay, let's move on to the next question. A foreign body aspirated by a patient usually goes into, now you have to be really fast with this, very simple question, right bronchus, left bronchus, esophagus, or both? Okay, good. So the answer is the right bronchus, and it's very obvious because it's wider than the left and also due to its more vertical orientation from the trachea. Good. Scoreboard, please. It's team 35 now. Right. Next question. The occurrence of spontaneous movement of muscles initiated by voluntary movement of one muscle is termed as synkinesis, ataxia, dyskinesia, or none of the above. It is, oh, well done. Okay, this is also called as aberrant regeneration. It occurs after injury, very common with facial nerve as a common sequel of facial palsy. Okay, scoreboard, please. Team 35 again on the lead. All right. Next question. Okay, let's see. The agent applied to prevent ear desiccation following trauma is mefenidazonide, iontophour, gentamicin sulfate, or all of the above. Okay, the answer is all of the above. See, remember, ear is a very prominent part of the face after nose and eyes and is prone to desiccation. An ideal moisture balance is essential for healthy ears. You must always aim at that. Scoreboard, please. Well, it is team 35 again on top. Okay, let's move on to the next question. Okay, this is a pictorial one. What is this test used for? Is it Frey syndrome, sialolithiasis, sialomandibular syndrome, or parotid duct injury? Wow. Okay, all five have got it right. This test is called the starch iodine test. The white starch turns blue or brown in the presence of iodine and sweat. But another interesting fact is that nowadays we use infrared thermography to quantitatively measure Frey syndrome. Okay, scoreboard, please. Team 35 again. Okay, let's move on to the next question. Which of the following is not a complication of hyperbaric oxygen therapy? Ear barotrauma, tracheobronchial injury symptoms, seizure, or irreversible myopia? Get the question right. which is not a complication of hyperbaric oxygen therapy. Okay, well done. It is irreversible myopia. But please remember, reversible myopia for 4 to 6 weeks has been encountered. So that's the trickiest part. The other complications of hyperbaric oxygen include sinus pain and claustrophobia. Okay, the scoreboard now. Team 35 again. Okay, well done. Next question. Problems related to increased airway resistance is seen as a long-term complication commonly after which of the following procedures? Superiorly based pharyngeal flap, inferiorly based pharyngeal flap, both A and B, or palatoplasty. Okay, so the answer is superiorly based pharyngeal flap. It is commonly used for correction of PPI, and the increase in airway resistance has been attributed to the obvious decrease in diameter of the airway. Right, so next, the scoreboard, please. Okay, here is a change. Team 34 on top now. Right, that's good competition. Let's move on to the next question. All of the following are reasons for non-union except avascular necrosis, bone fragment instability, small parafunctional movement, and trauma in earlier phases. Okay, good. I think this was quite an easy one. Let's move on to the next. Let's move on to the scoreboard now. Team 34 again. Okay, let's move on to the next question. According to the classification of bad splits, type 1E, I'm talking about BSSO here, type 1E refers to the fracture of proximal buccal segment, angle, vertical, or oblique ramal segment. What is the different classifications of, okay, right. The answer is oblique ramal segment. See, this is a very important thing that you all should know as PG students. There is a nice classification, beautiful explanation given by Steenen, okay, in a systematic review published in iJoms in 2016. And the different sequel, yeah, it is a must read for you all. Okay, let's check the scoreboard. Team 34 again. Okay, good. Let's move on to the next question. After skin excision for lower blepharoplasty, full thickness skin graft is needed. Your choice of harvest would be retroauricular region, thigh, abdomen, or cheek. Okay, very good. I hope you all know the answer. It is favored, the justification, it is favored because of its high resiliency and elasticity and its thin and hairless structure. Okay, full thickness retroauricular skin graft is therefore an effective treatment modality. Okay, let's check the scoreboard. Team 34 again. Right. Next question. Now you have to be really fast with your browsing now. Ozena is a common complication seen after what? Rhinoplasty, palatoplasty, tumor resection, or sialolithiasis? Right. Okay, it is characterized by intranasal crusting, atrophy, and a fetid odor. Right, scoreboard, please. Team 34 now. Right. Next question, please. Telephone deformity, ear deformity refers to root of the helix in the ear lobule protruded, middle half or third of the ear is set back against the head. Root of the helix and ear lobule retruded, middle half or third of the ear is set back against the head. Root of the helix and ear lobule is protruded, middle half or third of the ear is set forward against the head. Root of the helix and ear lobe retruded, middle half or third of the ear is set forward against the head. Okay, the answer is A. And remember this, It occurs with overcorrection of the middle third of the ear, aggressively tightened with mattress suture, and sometimes when you do over-resection of the conchal bowl or over-resection of the post-auricular skin. Okay, scoreboard now. Team 34 again. Right. Next question. Come on, we need some change in dynamics. Other teams. One of the complications of nasal injury which requires immediate intervention. Now you have to be really fast with this. Deviation of septum, deviation of nasal bones, septal hematoma, or depressed dorsum. Easy one. Okay, good. Yes, it is considered septal hematoma is an emergency. When neglected, it can result in cartilage necrosis leading to saddle nose deformity. Scoreboard, please. Team 34 again. Okay, next question. Which of the following is not a component of Eagleton's criteria? Paresis of 3, 5, 7 cranial nerves due to inflammatory edema, venous obstruction, retina conjunctivitis, meningeal irritation, or bloodstream infection. Why? This was such an easy question. The answer is A, because Eagleton's criteria consists of 6 features. This is to establish the diagnosis of cavernous sinus thrombosis. You need to have a known site of infection, infection of the bloodstream, early signs of venous obstruction, involvement of nerves. See, this is the tricky one, 3, 4, and 6. Okay, and then you have abscess in the adjoining soft tissues, and of course, signs of meningeal irritation. Right, so scoreboard now. Team 34 again on top. Okay, next question. Okay, herald sign characterized by recurrent bleeds from the mouth, ear, nose arises as a complication when infection involves masticated space, superior mediastinum, pretracheal space, or the carotid sheath. Which one is that? You should be really fast with this. Easy one. The answer is carotid sheath. See, this is one of the serious complications of lateral pharyngeal space infection, which leads to carotid artery erosion or rupture. See, some team is feeling really bad. They missed out. Okay, next. Scoreboard, please. Team 34 again. Right. Next question. Okay, Kussmaul breathing, a consequence of metabolic acidosis, is characterized by slow shallow breathing at regular intervals, deep rapid breathing at regular intervals, deep rapid breathing at irregular intervals, slow shallow breathing at irregular intervals. Remember, it's a consequence of metabolic acidosis. Okay, so that was the answer. It is basically a type of hyperventilation, and it is an attempt to expel carbon dioxide, which is an acidic compound in blood, very common in diabetic ketoacidosis. All right. Scoreboard, please. Team 34 again. Team 34 and 35. All right. Next question. Koenig's sign that enunciates meningeal irritation is flexing the hip to 90 degrees, then extending the knee causing pain. Flexing the patient neck causes flexion of the patient's hip and knees. Flexing the hip to 60 degrees, then extending the knee causes pain. Look at that really fast. Right, that's the answer. So it's a bedside diagnostic sign used specifically to assess a patient's risk for meningitis. Bedside one. It is important along with 2 other important signs, Brodzinski signs and nuchal rigidity. Scoreboard, please. Team 34 again. Right, next question. Marcus-Gunn phenomenon or jaw winking phenomenon is a congenital or acquired deformity characterized by ptosis or palpebral movement stimulated by contralateral mandibular movement. The second one is by ipsilateral mandibular movement. Both A and B are possible, or is it none of the above? Which one do you think Marcus-Gunn phenomenon is? There's a frequently asked Viva question. Again, yeah, not everyone has answered it right. Okay, this is also called as a pterygoid levator synkinesis or trigemino oculomotor synkinesis. It may develop after eye surgery or trauma. So here, as the name suggests, there is an abnormal connection between the motor branches of the trigeminal nerve and superior division of the oculomotor nerve. Okay, scoreboard now. Team 34 again. Okay, now to the last question. Yin-yang sign is a characteristic feature of one of the following complications: aneurysm, progression of cerebral tumor, degenerating condyle, or osteomyelitis of maxilla. It's quite easy to find out actually. Again, we have a difference. Okay, three have answered it right. Aneurysm. This is the appearance of aneurysm on Doppler, which demonstrates a swirling or disorganized pattern of blood flow within the lesion. So it is characteristic of aneurysm. Now the scoreboard. Well, by the end of round 3, we have team 8 in the third place, team 35 in the second, and it is team 34 on top. Well done. The others can still catch up. But before we go into the next round, I think we have an audience round. Mr. Chandru, can we have the screen, please? Okay, now the next round for the audience is this. Of the following ballistic injuries, which has the propensity to induce a cavitatory effect? Penetrating injury, perforating injury, both have the same, or is it an explosive injury? This question is only for the audience. Which has the propensity to induce a cavitatory effect? Where is this answering starting from? Madhu or Vimala, are you? Because there are answers for the earlier questions also.
From 820.
Huh?
8:20. See the timing.
18.
Okay, right.
See the timing. Yeah. 8:18.
Okay. Yeah.
Dhanalakshmi is the first one to answer. I don't know whether it's right or not.
Dhanalakshmi answered first.
This is the right one.
Okay, we have the right one there already, Mr. Dr. Shivakumar.
Yes, A. Right.
Dr. Shivakumar. The answer is A.
Shivakumar again. He got it on the
Very
second round
good.
also.
Yeah, very good.
I think Sharmila is before that, lesson. Is it Shivakumar? Okay, Shivakumar.
Shivakumar. Okay, good, very good. Now gear up, everybody. The next round is going to be really, really exciting.
Thank
over
you.
to you, Dr. Arun. Over to you.
Yes. Thank you, Lavan. That was a tough round actually, but it's not so for the participants. They all answered quite well.
Yeah, they did.
I think I didn't score even 25% of the questions. That was really tough one. And Chandru, can you add Professor Dr. Veerabalu?
We have our president with us. Welcome, sir.
Welcome, sir.
Thank you. Excellent.
Chandru, can you? Yeah.
Lucky I was not asked to answer this question.
That is already in, sir.
I think Venil and myself will be thinking, did we set an easy paper or were the kids so very smart?
They were really smart. Yes.
Guidance was really tough. I don't know. They answered quite well. And I couldn't even read the questions and they got it. The answers are keep popping up. At least Madhupriya, I was able to answer something, but Venil was quite tough.
But I did notice some internal fights and all there between the team members.
Within the team members, yeah, they are all in the same grade, right?
But can't they Google and find out?
No, sir, it's the speed that matters, sir. If they are going to Google, it's going to cost them marks. Okay. So I don't think it works that way. Right, sir. Welcome you all. Welcome, sir. Busy schedule. You are here.
So happy to have you, sir. So happy
Very happy to have the
Thank you,
president.
Vimala. Thank you, Madhu. Thank you, Elevenil. Thank you, Arun.
Yes, the
Thank you,
president is
Chin.
here. The president is here. And we are now on to the Zoom platform, sir. Now the Kahoot platform is over. Now we are going to have a Zoom live platform. This is going to be the 4th round. And yes. Chandru, you have to allow me to screen my
So you can share it, sir.
yeah, I guess. Yes. Participants, as you're aware, this has 4 rounds, and you choose yourself among who's the team member who's going to appear for each of the team for each round. Okay, and the order is going to be like this. The first team is going to be 08, and the second team is 18, third team is 34, and the fourth team is 20, and the fifth team is 35. This is going to be the order of questions. And Venil, I just want you to keep note of the timing.
Sure.
And the first round timing is going to be, that's the video round. You have 15 seconds.
Right. Yes.
Right. You have 15 seconds, just count. And the question passes. The question was not answered by the team, which is directed to. The question passes on to the next team. Is that all right? The first round is going to be the video round, and the second round is going to be 4 pictures round. Third round is going to be the connecting clues, and the last round is going to be the spotter. Are the participants ready? One of you unmute yourself who's going to appear for this first round.
Yes, sir.
Yes, all of you. Check your mic as well. Do you have all the 5 members of the team? No, I want only one of you to appear on the screen. Right? Only one of you to answer these questions. Okay? So this is going to be the video round. So here's going to be your first round, and it goes to team 808. Just watch this video carefully. Don't discuss, don't. Your timer will start at the end of the video. All you have to identify, what is this? Have to explain also the stage of the disease. Yes, your time starts now.
Anterior displacement with reduction.
With reduction. That is correct answer. Congratulations, team 08. It is anterior displacement with reduction. Can you classify the Wilkes? You're not going to get extra marks for that, just for the sake of it. What stage of Wilkes is this?
Stage 2.
Stage 2. Yeah, stage 2. That's right. That is an intermediate stage. That is stage 2. Team 8 scores 1,000 points. Madhu, are you noting? You can allot team 8 1,000 points for the first video.
I noted it down, sir.
Yes, thank you. Over to the second team now, team 18. You have to take up this video. I have 2 clippings of this. Watch both. Team 18 alone, unmute yourself.
Time starts now.
No. Actually, they should have known the answer by now.
Reads needle cricothyrotomy.
You got the answer wrong. It passes to team 34 now.
Guided intubation.
Team 34. Unmute yourself and then answer. Question passes to team 34. No? Passes? Passes to team 20. Team 20, unmute yourself. What is the
It's
procedure?
wire-guided intubation.
What?
Sir, it's wire-guided intubation.
I want the correct terminology.
Uh,
I'll give you a few more seconds.
so,
Intubation, it's always intubation. Everybody knows that.
sir, it's wire-guided nasotracheal intubation.
No, wrong. Team 35?
It is retrograde intubation with railroading of the endotracheal tube onto it.
That's perfect. It's called retrograde intubation, railroading from the throat to the nose and then inserting the tube. So team 35 gets the points. Right, it's called as retrograde intubation. Right, over to the third question now. Right, team 34 supposed to answer. Unmute yourself, team 34. Have to identify the procedure. I want the correct now. Your time starts now. Team 34, are you on? Is the video clear? Is the video clear? 34?
The time is up, 15 seconds.
Team 34, I'll give you one more section. At least now you can answer. Because I felt that video is a bit, so I want to be a fair. This is the pictorial representation of what is happening. I'll give you a few more seconds. Team 34, what is the procedure? Your time is up. Team passes, question passes to team 20. Team 20, unmute yourself.
Sir, removal of the retrovalvular hematoma or something like that.
I want the procedure, a much bigger procedure. That is okay. That is removal, that's fine. I want the procedure, what is being done. Okay, next team passes to team 35.
There's a lateral orbital approach to remove the retrobulbar hemorrhage. Lateral orbital approach.
It's incorrect. Team 8.
Zygomatic swing.
Again incorrect. Team 18. I want the correct terminology. Team 18. That's the last team, right? This team was directed to 34, right? This question goes to the audience. If you get it right, you'll get a certificate. You can give the answer in the chat box. That is your lateral orbitotomy. It's an axis osteotomy. The procedure is called as lateral orbitotomy. So to remove the retrobulbar tumor. That is the procedure which is being done. None of the team have got it correct. So you move on to the fourth question. Team 20, unmute yourself. Yeah. Now I want to know the procedure. What is the procedure being done? I don't want the diagnosis. What is the procedure being done? I want the exact terminology. Time starts now. This question goes to team 20.
So pass.
Pass. Pass to team 35.
Cranial
Unmute, others unmute, please. One of you answer.
after dural repair.
Wrong. Incorrect. Passes to team 18.
Team 8.
Team 18.
8.
No,
Front
8.
orbital band for
Got it wrong.
craniosynostosis.
8. Huh?
Front orbital band for craniosynostosis.
Come again. Team 8.
Front orbital band for craniosynostosis.
Yeah, fronto-orbital advancement for craniosynostosis. That is correct. Team 8 got it right. So point for team 8. It's craniosynostosis. We have done a fronto-orbital advancement. This is the last question of the video round. This goes to team 35. Team 35, unmute yourself. Team 35, unmute yourself.
Yes, sir.
Right. Your question is, what is that they are doing and what is that? Identify that.
Sir, that is a fat graft being mixed and placed into position.
Incorrect. The question passes to team 8.
Preparation of nanofat.
Can you repeat, please?
Preparation of nanofat.
Again, incorrect. Passes to team 18. Team 18, are you there? Team 18.
Needs to unmute themselves, sir. They are not unmuted.
They haven't unmuted. Team 18.
Sir, it's PRP.
Incorrect again. Team 34.
Of cyanocolate.
Incorrect again. Team 20. Team 20.
Fat for giving graft to the TMJ.
Again, incorrect. All of you got it wrong. That is flow seal. That is a fibrin sealant. It's a mixture of thrombin and active gelatin form, which can be mixed and very useful for bleeding, particularly in TMJ and inaccessible region. That comes as two tubes, one as a gelatin and other as a thrombin, human thrombin, which can be mixed together and then keep it ready-made like that. It's like a gel form. Other issues is it's like tissel. It can be used as a fibrin sealant also. This is very useful in other laparoscopic surgeries and other things. Now we have started using in our maxillofacial setup also. It stops bleeding immediately, right? All you have to apply the gel over wherever you want. Just apply the gel and then apply a wet gauze over it and then leave it. It forms as glue. That is a fibrin sealant. The commercial name is flow seal or a fibrin sealant, which is tissel. So Baxter, that is the procedure which is being done. That is the end of the video round. Now we move on to the second round. That is the 4 pictures one word round. Right. This is, you have to use your lateral thinking, not to the subject. Of course, there is subject, but it won't be direct pictures from the subject. So you have to use a little bit of lateral thinking, which is very important for the surgeon's point of view. So it's like a fun game. And we will change the order now. The first team will be the last one. 35 gets the first. Madhu, please note it. 35 is going to answer first. So it passes in the reverse order. Here's your first clue. Your time starts now. You can take 20 seconds for this round. Venil, you can start your timer.
Yes.
What is this? Identify the disease. Venil, let me know if the time is up.
Yes, yes, sir. Sure.
Target cells. Yes.
Correct answer. Correct answer. Team passes to the next team. 20.
Central giant cell.
Central giant cell disorder.
Complete. Okay, I'll give it to that. It's central giant cell granuloma, right? So it's team 20 which got it right. Is that right? Yeah, please make a note of it. Here is your second clue. This goes to team 20. It's central giant cell and granuloma, right? That's the right answer. Right. It goes to team 20. Your time starts now. What is the procedure? Surgical procedure. 1, 2, 3 numbers. So you just follow the order. Team 20.
Time is up, sir.
Team passes to team 34. No, I don't give time for the other teams. Team 18. Team 8. Team 35. None of them got it right? Right. It is called as docking site surgery. Docking site surgery, which we do it in distraction osteogenesis, particularly in transport distraction. At the end of transport distraction, there is a site which doesn't form a proper callus, so you have to open up, do the plating up there. That is called as a docking site surgery. That is the procedure which is depicted here. Right, we'll move on to the next clue. It's team number 34 is going to answer. Time starts up. It's not necessarily arranged in a pattern. Just get the clues and get the answer because it was quite obvious, so I wanted to make it a little bit changed. Team 34. You get the answer?
The time is up.
Team 34. Your voice is not clear. Yeah? Amaki? Amaki?
Orbit area of orbit.
Yeah, it's Hammer's key area. You got it right. What is that? What is Hammer's key area? What is Hammer's key area? Can you explain? Team 34. Okay, anyway, I'll give it to you. That Hammer's key area is the most important point in the fracture reduction of orbit. That is the spinozostomatic junction, which you have to look at for three-dimensional reduction of zygomatic fracture. Right? That is Hammer's key area, which is the function of the zygomatic sphenoparatine suture. Right? So team 34 got it right. The next question goes to team 18. Yeah, your time starts now. Team 18.
Sign.
Yes, please come again.
Trapdoor sign.
Trapdoor.
Orbital fracture.
Trapdoor sign in orbital fracture. Blowout fracture.
To be more precise, trapdoor is fine. Other clues. You got the answer for the first two clues. What about the next two clues? Okay, let's see if the other teams get it right. I'll see. Team number 35.
Trapdoor appearance in orbit.
No, that's the same. Team 20.
Capnel line.
No. Team 34. Team 34. And team 18.
The trapnel sign. Trapnel line.
No, incorrect. It is a trapdoor fracture. That is a white-eyed blowout fracture, particularly in children. So trapdoor fracture is the right answer. Trapdoor sign.
Sir, we didn't get a chance. Excuse me, sir. Teammate didn't get the chance.
Didn't get the chance?
Yes, sir.
Did you know the answer at least?
Yes, sir. We knew the white. That is a pediatric fracture. It is an emergency. We have to operate it with our oculocardiac reflex.
Somebody could have prompted me. Okay.
But team 18 said trapdoor initially.
Yeah, that's why I want to give them half the marks actually for the team 18 because they got the trapdoor right. Okay, I'll give 50% for the marks for team 18 and 50% for team 8. Is that okay?
Yes, thank you, sir. Yes.
Let us be fair. Okay, 500 points for team 18 and 500 points for team 8. Right? And the last question goes to team 8. Is that right?
Yes, sir.
Okay. This is a similar one. Team 8. Where is it up?
Ameloblastoma.
Yeah, ameloblastoma is the right answer. There's enamel, forming organ, blast, and stoma. So ameloblastoma is the right answer. Team 8 got lucky. He got a sitter. Thank you. This is the end of round 2. And now, Benil will have 30 seconds for answering this question. It's a bit tough, I think. So, so this question, it's again a pictorial round where all the 4 pictures won't be shown up front. You have to call for pictures for the next pictures, right? If you get the answers right in the first picture itself, you will get 2,000 points, right? If you're going to answer with the second picture, you will get 1,500 points. If you get the answer for third picture, you will get 1,250 points. And with the 4th picture, you will get 1,000 points. But it's up to you to use the 30 seconds to call for the next picture. I won't put up the picture unless you ask that. And once you open up the mouth, that's the end. You don't have a second choice to answer. Even with the first picture, the question passes on to the next team. Is that fair enough? Can we start the round? And Venil and Madhu, please guide me if I'm wrong with the teams, right? So we'll start with the first team. Is that okay? Or you want to change in order? Like start in the middle. Okay, we'll start from middle. I'll start from team 34. Right? Team 34 is going to be the first one. Team 34, I want a clear audio in this because you have to call me for the next pictures. So team 34, this is called as a connecting clues round. Team 34, here is your first question. You have to ask me for the next picture if you want the next picture. Right. Identify the disease. What is the connection between this guy and the disease?
Trigeminal neuralgia.
Perfect. That's the way to go. Trigeminal neuralgia is the perfect answer because he is the patient with the trigeminal neuralgia. I'm surprised. Okay, these are the other clues. Pick Dolorax and the trigger. I thought you'll get the answer only with the trigger. So team 34 gets 2,000 points. Congratulations, team 34. The next question goes to team 20. Team 20, unmute yourself. This is your first clue.
Bell's sign.
You can ask for the next clue if you want.
Sir, Bell's palsy.
Wrong answer. Team passes. Question passes to team 35. Don't give the wrong answer if you're not sure. Team 35. You want the next picture?
Yes, sir. Next picture.
Yes, next picture is on. You want the next picture?
Next picture.
When you are having the time,
Yes, sir.
let me know if it is finished.
Sure, sir.
Next picture.
That's the last picture.
The time is up.
Time is up. Sorry. Team passes to the 35. Is that right?
Now you said it's team 35. So
No. Team 8. Sorry, team 8.
Excuse me, sir.
Team 8. Team 8, you have to be with the answer. I don't have time for you. All the 4 pictures are out. Do you have the answer? Passes to team 8.
Sir, retinoblastoma?
No, wrong. Incorrect. Team 18.
Cavernous sinus thrombosis.
Again, wrong. Team 34. I thought this was a simpler one. Team 34.
Retrobulbar.
Perfect. That's correct. Retrobulbar hemorrhage. Right? Retrobulbar and hemorrhage. That is the picture of a retrobulbar hemorrhage itself. So team 34 got it right. They will get 1000 marks because they got answers with all the 4 pictures. So they will get 1000 marks. Madhu, have you made a note of it?
Yes, sir, noted.
We'll move on to the next question. This question goes to team 35. Am I right?
Correct, sir.
Right. Here's your first clue. You want the second picture? You have to call. Team 35. We want the second picture. You have 30 seconds. Team 35, I don't hear you.
The second picture.
Yes. This is a procedure.
Marsupialization.
Perfect. That's correct. Marsupialization is the right answer. Team 35. You got it right in the second clue. So I'll give you 1500 points. Marsupialization is right. That is the Australian cricketers with the baggy green cap with the kangaroo on it. So this is marsupialization. I'll give you the third clue. That is a pouch. And it is the kangaroo itself. That is marsupialization, which derived its name from the marsupial kangaroo, right? That is marsupialization. So team 34 got 1500 points.
Team 35 got 1500.
30. Is it 35? Okay, you please make a note of it. I'm just getting confused. Is it team 35?
Yes, sir.
Yeah, okay, fine. Now the question goes to team 8. Is that right?
Yes, sir.
Yeah, here is the clue. Right, here's your first clue. Timer starts.
Yes, start.
Next.
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 You want to be sure. This is the procedure, again, surgical procedure.
Yes. Next.
The time is up.
Time is up. Passes to team 18. You have the answer, 18? Passes to team 34. Team 20. And team 35.
Hilton's approach.
That's perfect. That's Hilton's what? Can you be more specific? Hilton's what?
For
Hilton key.
drainage.
Hilton's water.
Hilton's what? Team 35. Others, please unmute yourself. I mean, mute yourself. Team 35. Hilton's.
Hilton's as approach to not approach.
Hilton's
Method for sinus drain.
Want to be more specific? Your audio is not also not clear. Hilton's what?
Method for drainage.
I'll give it to you. It's not sinus drainage. It's Hilton's method for IND, incision and drainage. I'll give it to you. That is H is the Hilton's logo of the group of hotels. And the next one is Paris Hilton. And the third one is just a clue for a sinus forceps, right? Hilton's methods of IND. And the last one is the pus. So it is Hilton's methods of incision and drainage. I'll give it to you 35. So 1000 points for 35. So how many questions over? 4, right?
4 over, sir. Last
The
question.
last question goes to team 18. Is that right?
Yes.
Right. This is not a pictorial clue. It's a straightforward clue. Straightforward radiologic picture. Identify what is this.
A Stepney cyst.
Perfect. That is correct straight away. It's a Stepney's cavity. Team 18 will get 2000 points. That is the other views. That is a CBCT view. This is your coronal section, and that is your axial section. So team 18 gets 2000 points straight away. Right now, the connecting clues round is over. We'll move on to the next round. That is the last round of this session. That is your spot diagnosis. This almost a clear picture will be given. You have to give the diagnosis. And you have 15 seconds for answering this question. And how will we start? We'll start from team 20. Is that okay? Team 20. Right, team 20, are you ready? Here is your first clue. What is this?
Video laryngoscope.
That is correct. It's video laryngoscope. You get 1,000 points straight away. Team 20 gets 1,000. And the second question, what is identifies this disease? Team 35. You have 15 seconds to answer this question. Watch all the pictures carefully and then answer. One of the pictures gives you the diagnosis.
It's lymphoma.
Incorrect. Passes to team 8.
Paget disease.
Is that team 8 which is answering?
Paget disease, yes sir, teammate.
Yes, you are right. It is Paget disease. That is a typical cotton wool appearance. So it's Paget disease, right? So team 8 gets 1,000 points. And the next question goes again to team 8. Is that right?
Yes, sir.
Yes, sir.
Yes. Right. Identify this disease. Watch carefully the CT sections.
TMJ ankylosis, sir.
Wrong answer. Team 18.
Crouzon syndrome.
I want the exact diagnosis.
It's craniosynostosis with.
Wrong answer. Team 34.
Sir?
Wrong answer. Team 34. Team 34. Passes to team 20. 20. Are you there? Wrong answer again. Team 35.
Sir, Perorobin malformation.
Again, wrong answer. I think all of you have got it wrong. This is synnathia, complete maxillomandibular fusion. That is called as a synnathia, which is a quite rare disease. The total maxilla and mandible is fused together, right? That is synnathia. Right. The next question is for team 18. Is that right?
Yes, sir.
Right. Identify the procedure. What is being done here? Team 18. A few seconds left.
It's a nerve graft taken.
Graph is fine. It's obvious. Just one what is. Passes to team 34.
So, sural nerve.
That is correct. Sural nerve grafting.
Sural
nerve. Sural nerve grafting, which is being done. Team 34 got it right. Give them 1,000 marks. Right. And here is the last question of the entire finale. That's team 18 is going to get it, right?
Team 34, sir.
Team 34, I'm sorry. Team 34, yeah. Right. Identify what is being done here. This is a procedure again. I want a complete explanation of this question. Team 34.
Sialography.
Incorrect answer. Team 20. Team 20.
Pass, sir.
Pass. Team 35. There are no negative marks. I don't know why do you want to pass. You can make a blind guess. Team 35.
The blocking of a feeding vessel of an aneurysm.
Can you be more specific?
A metal ball or a fibrin kind of glue is used, which is actually used to block up the feeder vessel of an aneurysm.
Okay, I'll get the answer from team 8 and then come back to you. Team 8.
Selective embolization using the titanium coil.
Okay. And team 18.
Sir, arterial catheterization.
Wrong answer. So I'll give 50 marks to team 8 and 50 marks to team, which is the one which answered before.
Team 35.
35. I think we'll split up the points. It is selective embolization of a AVM, high flow AVM of mandible. We have catheterized to femoral artery. The second picture shows the contrast being injected, and the third picture shows the actual embolizing material. We have used here as embolizing material. So that is high flow AVM of mandible. So I'll give 50 marks to team 8 and team 35, 500 each. Is that fair enough? Now we come to an end of all the sessions. Do you have a question for audience? Okay, let me play it for the audience. 1 second. And Chandru, you calculate all the points together.
Just max by 2 to 3 minutes.
Yeah. Meanwhile, I'll play some videos. Right. This is for the audience. Identify the procedures and answer in the chat box. I hope all the rounds were quite interesting.
Very interesting, Arun.
Yes, sir. We want your comments. Actually, I want to.
Thoroughly enjoyed it.
Thank you, sir. Thank you very much, sir. The president is happy. I think everybody should be happy.
Really, all of you have done wonderful. They made it very interesting.
Yeah. Audience, you can answer this question in the chat box. What is the procedure being done? It's not a procedure, actually, it's a test. Yeah. Meanwhile, we'll calculate the marks all together. I think the last round will have a effect on the scorecard, really, because it's been monotonous, the first and last round. I think it will make a difference in the last round. It's like typical IPL. I may have one more question for the audience. Answer this also. Identify what is the problem here. I'll play the video again if you have missed. I wanted to make it short. That is why all the videos are quite edited, quite crisp. That is the point. Other things are usual. Audience can take up this question. Yeah. Thank you. Sir, President, sir, some words on it, sir.
The results are out, or
not yet, sir. Not yet, sir. We have to wait, sir. There is some manual calculations involved because it's out of Kahoot. Kahoot means you'll get the answer in a split second.
Okay.
But we have made 2 rounds, which is we have made some manual work also. So it will take a few minutes so that you can.
I happened to join at the time of Dr. Vainil's thing. I had missed the earlier rounds because I had some work today. First, I would like to thank Dr. Jimson for inviting me for this program, and also I would like to thank all of you, Madhu, Vimalambika, Vainil, for putting up such a lovely show. It was really very interesting, and you made it very catchy also. First, I also want to congratulate all the participants. See, winning or losing doesn't matter. Participation is what is very important. Remember that you are always learning, whether you may win today or lose today, but you're always learning it. So wishing you all guys all the very best.
Thank you, sir. We'd like to have some views on the participants.
Sir, please hang on, sir.
I am.
You can't run away.
Please let the results
come
come out. Yeah, please.
Jimson, your views also.
I'm
The results ready?
Results are ready?
Yes, sir. I'm just sharing the Excel. So to maintain the transparency.
Yeah, please.
You need to unshare it, sir.
I'll stop there.
These are the results, sir. Team 34, 218, followed by 35, 8, 20, and 18. Sir.
Sorry, Chandru.
Yeah, it's all quite confusing.
So actually, the first 3 rounds has been calculated by Kahoot, sir.
Okay.
Round 4, we have added it manually.
Okay.
And for the round 4, it is team 8 and team 34 sharing the same marks, 5,000.
Okay.
And the second highest score in the last round was team 35 with 4,000 points. And then you had team 18 at the 4th spot with 2,500 points. And the last was team 20 at 2,000 points. Or rather, the 5th was team 20 at 2,000 points. These are the scores only for the last round.
Okay, now you have to
it manually, which has been added to Kahoot. And the total, finally, team 34 stands first.
34 stands first. Okay. Team 34, 35, 8, 20, and 18. That's the order, right?
Okay. Okay.
Okay.
Hang on.
And I'll let you know the answers for the audience round also. So please somebody make note of it. Post-suction test is the right answer. Just kindly note who got it first. And the second is a little bit ambiguous. It is actually the medial rectal palsy which has happened actually. But the signs may indicate it's a lateral rectal palsy also. So we'll go to the...
It is a medial rectus palsy, because
yes,
he's not able to move the eye medially towards the left
yes,
side.
Towards that's what
But
happened.
the lateral rectus was working. He could move the eyeball laterally. So it was not very ambiguous in my point of view. Medial rectus palsy, I could.
Sometimes it does the opposite, right? So if there is a palsy on the other side, it's not a palsy, it's an entrapment actually.
Entrapment.
It's a fracture. It's a lower fracture with the medial wall. So the medial movement is not possible. So medial rectus is the right answer. So kindly note who made from the audience list also. We will announce it later. Right, over to you, Jimson.
Just give me a couple of minutes.
Sure.
You can make some more comments. I'm just getting.
Yes, sir. Yes, I'd like to have the comments of the participants also.
We can take a feedback from the participants also.
Participants, we would like to have your comments. Team 8, one of you come and then comment. I'll call you up. Team 8, somebody unmute yourself and we want your feedback.
Hello.
Yeah.
Yes, sir. It was a excellent quiz. I mean, the last round was it was really out of this world. I mean, the questions and it. I mean, we can see how much effort it would have taken for making the quiz. I mean, it was really very interesting.
Thank you. It was a pleasure. And you all competed quite well. Your answering level was a bit very high because even we found it difficult the other rounds, mutually, I think.
And when I joined Vainil's round, I thought I'm going to fail all the questions.
Very true. All signs and symptoms named.
I started getting palpitation.
Right. Can I have some comments about Team 18? Team 18, somebody? Team 18, unmute yourself. Can you show up? Team 18? What happened? Team 18 is there? No one?
Team 18 has gone for a coffee, I think. They have to unmute.
Saturday night coffee, sir.
Saturday night coffee, yeah. Team 34? Somebody from Team 34? Yeah. 18 is here.
Especially in front of such eminent faculties. And moreover, the last round was kind of like an adrenaline pump for us. It was truly amazing. I don't know how to express my with gratitude and happiness, excitement. It was truly wonderful, ma'am, as well as everyone who took effort for this. Thank you so much.
And thanks to our HOD sir, Dr. Suraj Kumar LK and Dr. Nikhil Kantikiran sir for guiding us.
They guided us so much through the last week. They were guiding us like so much through all the textbooks of online maxillofacial surgery.
That's quite great of them.
Yeah. Thank you so much.
Thank you. And team 34? This is team 34.
Yes.
Okay, team 20?
34 is the winners, right?
That is why there can be the excitement source. Team 20?
Yes, sir.
Yes. Comments, please. I'd like to have some negative comments also. Don't worry. It's not a viva. So you want to improvise next time?
That they will tell once they finish the course.
No. We want some drawbacks so that we can rectify in the next event itself, right? If there happens some difficulty, some technical issues, or whatever it is. Team 20, yes, please.
But I have one thing, that retro.
Yes, sir.
How can we tell in that retro, the first slide itself, how can we come to the diagnosis? That retro.
You have to take a choice, sir. That's your luck. That luck plays a factor.
I thought some 16 vayadile doctor, what is this? What could be?
No, Bell's palsy was a good guess.
Bell's palsy was also correct. Bell bottom, Bell's palsy also.
That guess was correct.
I thought you should have given 50 marks. 50,000.
Not the right answer. He should have waited for the next clue, right? He has to play it safe. It's his choice, right?
Yeah.
I'm surprised about Salman Khan. That is my favorite
That was a brilliant.
That was brilliant. I was surprised.
He must be a Salman Khan fan, sir.
Fan must be. I was thinking night accident, cafe.
Yeah.
What could be this?
And I gave you a ball to Salman Khan to get the clue side. That's good. Team 20, your comments, please. You're not yet opened your mouth. You're unmuted again.
So,
yes. You're not audible.
Can you hear me?
Yeah.
Go ahead.
So actually, my batchmates have my teammates have they have left. They have left.
No problem. You can answer. You don't want to answer.
No, he's little.
Okay, fine. No issues.
Okay.
Hope you enjoy. Team 35. Team 35.
Good evening, sirs. Good evening, ma'am. It was actually a very wonderful experience and a competitive experience for all of us. And it is very evident that how much effort all the organizing committee, everything has they have put forth in this event. And most importantly, we would like to thank our sirs, that is Suraj Kumar sir and Nikhil Kurian sir, who actually guided us for the past 2 weeks in preparation of the same, taking extra time and extra efforts as well. And if possible, as a request, if these questions can be put forth for the Viva preparations and the things like that, it would be a great benefit for the students for the Viva preparation and the upcoming exams as well. Thank you so much, sir. For this.
You had a separate neat coaching for this quiz.
Actually, we would share these questions, the questions in the preliminary round as well as this final round with all the participants. So,
Jim, how many people participated in the first early this thing?
42 teams.
42 teams, sir. 42 teams.
Very good.
Out of
Excellent,
which we selected 5. I mean, not
Excellent
selected.
and very
They selected
interesting,
themselves.
and all the participants really appreciate their effort in answering.
And you have to congratulate their
department.
Department, yes, sir. It is a fantastic support that they have received. Can Dr. Ilavenil or somebody share this so that Dr. Veera sir can handle?
I think everybody has seen it now, Jim.
Not that, sir. Not that, sir. The price. So now I request. Can somebody see the WhatsApp group, please?
Yes, sir. Yes, sir.
So that's the prize that they are going to get. So now I request Dr. Veera Bahu sir, President AMSC, to hand over the prize.
I don't have the result. I'll have to just
No, sir.
You have to announce it, or Venil will announce it.
So no, sir, I will just project it on the screen.
Yeah.
Mr. Chandru, can you allow me to share the screen?
Ma'am, you can share.
Suspense, or do they know the participants know their mark?
No, sir, already.
Huh?
They know, sir, already.
Yeah, they know. They saw it. Say the.
Yeah.
I
Not
was just
that,
thinking.
sir. Not that, sir. The price.
Price.
Okay.
Price they are not aware.
No, they are aware of the price as well, but then they want the president to hand over the.
I will hand the price to all of them.
Digital.
So we start from the third one. The third one.
Teammate gets the third prize. A check of 5,000. Who is the sponsor for that? Our association or anybody else specifically sponsoring, Jim?
Sir,
Okay. You have to thank somebody. Okay. Congratulations, teammate.
Sir, actually, all these programs have been sponsored by Striker.
Striker, okay, Striker. Yeah. I thank Striker also. Congratulations, teammate.
Thank you, sir. Thank you
for acquiring this.
Don't worry, you will get the real check within a few days.
Congratulations. Wishing you very best. Keep working hard. Keep achieving more and more. Okay.
Can somebody name the team?
Yes, sir.
They'll be happy.
The second.
Let us give a round of applause to them.
Yes, sir.
You can zoom it out.
Yes, sir.
This is second prize, no? Team
Yes.
35. A check of 7,500. Congratulations, Team 35 and their department.
Wonderful.
Wonderful.
And now the winners.
Winner. The first prize goes to Team 8. No,
sir.
Team 34. A check of 10,000. Congratulations, Team 34. Maybe have a show of them, or can they show their still on live? Team 34, are they there? Are they left? Yeah. Congratulations, guys.
Thank you, sir.
Doing good work. This is just a beginning. You have a lot to achieve. You have a lot to do. We are all there for you. Okay. You're so lucky. You had such a wonderful faculty today. They have taken you through such a lively quiz. Okay. I wish I had an opportunity like this. I thank the organizers, Dr. Jim, and all the other quiz masters for this wonderful show.
Thank you.
Thank you, sir.
And congratulations to the winners. We would like the winners to join tomorrow for the OO symposium, so that where there is a larger crowd, we will like to announce these results as well. So there will be 400 plus participants tomorrow. So we would like you to join tomorrow for the meeting. And to Veera sir, thank you again for the wonderful support, sir. Thank you for joining.
I have to thank you. It's such a lovely program, and you're doing such a wonderful job, Jim. I think Tamil Nadu is on top in this pandemic in terms of delivering these quality contents to our students, and you are making all of us very proud. Thank you very much again.
Thank you, sir.
And I also thank Arun, Madhu, and Venil for such a wonderful job.
Thank you, sir. Thank you very much.
Yes, sir. Actually, I would like to thank Venil, Madhulakshmi, and Vimlambika for the fantastic support that they've been giving for the last couple of sessions as well. Not only this, and then Arun joined in for this session. And I should say, I should compliment Arun, because he was very particular that we do this fourth round this way. Fourth round this way. So I gave in to Arun's persistence, and then he managed to convince me, and then no wonder all the participants liked it, Arun. That's all.
Thank you for the opportunity.
I think
like
you should
he
have a
says,
cup
it
of.
stimulates your lateral thinking.
Yeah, I think you should have a cup of coffee, Saturday night coffee.
Sure.
Together.
I'm waiting.
Thank you.
Thank you.
Thanks.
Fantastic.
Thank you, everybody.
Thank you, Striker, Mayank, and Chandru.
Our sincere thanks to Striker, Jim.
Yes.
Please convey our
Sir.
thanks to Mayank and everybody. Okay.
Yes, sir.
And,
Thank you all.
Jim, please assure the audience also to get their certificate for the correct winners. Ask them
Yeah, we'll do that.
Make a note of it.
I think. Who has got the list?
It's in the chat box.
No. I think we can, if possible, we can announce them also now.
Yeah, please. We don't know their details actually.
No, that's already. You can call out the names and then.
Names is there, but certificate has to reach there so that they can mail their address.
Yeah, I'll do that. But is somebody announcing it?
I don't have the list. Who made a note of that? There were 5 questions, right?
So for the first 2 questions, one is Dr. Satyabama.
Yeah.
For the second one is Dr. Shivakumar Loganaran.
Yeah. Third one also Shivakumar.
The third one also Shivakumar.
Yeah. Fourth and fifth.
Dr. Satya seems to have answered all the questions.
No, it's the first one. First come first.
So timing also is there. Okay.
Yeah. Because chat you can copy and then put it again. So that's not the issue.
First is Dr. Satyabama. Second is Dr. Shivakumar. Third is again Shivakumar. Fourth
question.
Fourth was the video one, sir. Video question.
No, the fourth section test. Who got it right?
Dr. Van Mugil.
Right? He got the first one. Van Mugil.
Very good. Yeah. Fifth.
And the fifth one, medial rectus.
Can you stop the screen share, please?
Yes, sir.
Otherwise, the audience should not think that they are getting that.
Suresh Kumindaraj. I think this is a faculty, right? Is that Suresh?
Who's that?
I think it's my Suresh.
That we can't allow. It's a
it's for faculty. No, he's a faculty. He's not a PG. Anyway, happy to be part of it. Suresh.
Yeah, if the winners can get in touch with me, please.
Yeah, please.
Because I only know by names, so if you can get in touch with me, I will.
Your mail address or something like that. Contact so that we will get your certificates.
Yeah, hope you have my number. If not, I'll just type it in the chat box.
Jim?
Yeah,
sir. Good to
Thank
go.
you, sir.
Thank you. See you.
Thank you, sir.
See you tomorrow, sir.
Cheers for the Saturday night, sir. See you, sir. Thank you very much, sir.
Bye, sir.
This is my contact number. You can call me. Send me your details right away, and you will receive the certificate within a couple of days' time. Thank you. Thank you very much. 3 cheers to the faculties. You have made it.
Thank you.
Thank you.
Wow. Fantastic. I missed it.
Always a pleasure, sir.
I missed it.
Thank you.
Anyway, we have the recording.
Yes, sir.
Thank you all. Good night. Good night. See you all tomorrow.
Good day. Bye.